Let's talk about training programs.
Training is a basic component of practitioner competence. A core ethical and professional issue involves formulating policies and procedures for selecting appropriate candidate for a training program.
What criteria should be used for admission to training programs? Should the selection of trainees be based solely on traditional academic standards, or should it take into account factors such as personal characteristics, character, and psychological fitness? Is there a good fit between the candidate and the training program? To what degree is a candidate for training open to learning and to considering new perspectives? Does the candidate have problems that are likely to interfere with training and with the practice of psychotherapy?
What are some ways to increase applications to programs by diverse groups of candidates? How open are training programs to diversity? How open are they to including people who will challenge them as trainers?
How thorough should an orientation to a program be? What should it include? How does a program determine the psychological fitness and character of a candidate?
Training programs have an ethical responsibility to establish clear selection criteria, and candidates have a right to know the nature of these criteria when they apply.
Although grade point averages, scores on the graduate record examination, GRE, and letters of recommendation are often considered on the selection process, relying on these measures alone does not provide a comprehensive picture of the candidate.
Personality characteristics, character, and psychological fitness are important variables to consider in selecting applicants.
However, there's currently no consistent approach to screening for character and fitness during graduate school admission. Similarly, there is no consistent approach to effectively addressing problems with character and fitness once they are revealed. No research in psychology demonstrates the efficacy of a screening approach to character and fitness. It is agreed upon that a lack of psychological fitness threatens to undermine a practitioner's ability to reliably and effectively serve clients.
It is important to meet with applicants in some kind of personal or group interview process.
Although some faculty will protest the time it takes to conduct individual and group interviews as part of the admission process, it is considerably less time and effort expended in dealing with even one problematic student who is admitted and who later faces dismissal from a program for non-academic reason. Many programs ask candidates to write a detailed essay that includes their reasons for wanting to be in the program, their professional goals, an assessment of their personal assets and liabilities and life experiences that might be useful in their work as counselors. As a part of the screening process, ethical practice requires that candidates be given information about what will be expected of them if they enroll in the program.
A number of programs have both faculty members and graduate students on the reviewing committee. Screening can be seen as a two-way process. As faculty screen candidates and make decisions on whom to admit, candidates may also be screening the program to decide if this is right for them. Educators who fail to adequately orient prospective and current students regarding expectations and evaluation procedures heighten the risk of conflicts with ill-informed students.
Some programs are structured around a specific orientation in two ways: first, by the school itself having a specific orientation, and second, by insisting that students subscribe to one theory at some point in their training.
Other programs have a broader content base and are aimed at training generalists who will be able to step into future positions that present evolving challenges.
It is recommended that students be exposed to the major contemporary counseling theories and that they be taught to formulate a rationale for the therapeutic techniques they employ.
It is a good idea to teach students the strengths and limitations of contemporary counseling theories.
Look at your program and ask how it measures up against these questions. Is the curriculum inclusive of many cultures, or is it culturally biased?
Does the curriculum give central attention to the ethics of professional practice? Does your program have a specific course in ethics? Is it enough to hope that ethical issues will be addressed through the supervision process alone?
What is the proper balance between academic coursework and supervised clinical experience? What core knowledge is being taught in your training program?
In training programs for various mental health professionals, general content areas are part of the core curriculum, which are generally outlined by CACRUP, 2009, standards.
The following areas are typically required for all students in counseling programs: professional orientation and ethical practice, social and cultural diversity, helping relationships, group work assessment, and research and evaluation.
A good program challenges students to examine their attitudes and beliefs, encourages students to build on their life experiences and personal strengths, and provides opportunities for expanding their awareness of self and others.
It will infuse in students the importance of self-care and emphasize wellness throughout the program.
Although ethics is supposedly incorporated in a number of required courses, seminars, supervision, and practicum and internship experiences, it is believed a lack of systematic coverage of ethical issues will hinder students, both as trainees and later as professionals. Programs geared to educating and training counselors should be built on the foundation of the natural talents and abilities of the students. It is imperative that counselor educators and supervisors display cohesive relationship among themselves and treat students in a respectful, collegial manner.
As students in a counselor education program, you have a right to know how you will be evaluated, both academically and personally. If you are aware of the evaluation criteria and procedures, you are in a better position to ask key questions that can influence your degree of satisfaction and your involvement in your educational program. Every training institution has an ethical responsibility to screen candidates so the public will be protected from incompetent practitioners. The criteria for dismissing a student should be clear and objective. Academic programs should have written policies that are available to students as part of the orientation to the program. Students need to know that their knowledge and skills, clinical performance and interpersonal behaviors will be evaluated at different times during the program. Ongoing evaluation of counselor trainees is crucial to determine whether students are making satisfactory progress in all areas of the training program.
In addition to assessing knowledge and skills competencies, it is of vital importance to assess personal and interpersonal competencies, such as the capacity for self-awareness and self-reflection.
A core aspect of the therapeutic process emphasizes the personal qualities of the therapist. The therapist's emotional resonance and responsiveness, social perceptiveness, compassion, desire to help, self-understanding and self-discipline.
In the author's view, possessing characteristics such as these lay the foundation for professional competence.
American Counseling Association, 2005. Counselors clearly state to students, prior to and throughout the training program, the levels of competency expected, appraisal methods, and timing of evaluations for both didactic and clinical competencies. Counselor educators provide students with ongoing performance appraisal and evaluation feedback throughout the training program. If 9.a.
It is believed that professional organizations have a key role to play in specifying minimum standards of competency by providing a clear definition of what it means for a candidate to be found unsuitable. This protects both future clients and students who may be facing dismissal from a program.
Faculty in these respective professional training programs would then have the backing of their professional association in determining their own specific set of evaluation procedures to be used in making decisions regarding retaining or dismissing students. A major problem faced by educators in these training programs is identifying, dealing with, and possibly dismissing students who are not making satisfactory progress toward professional competence. The academic faculty in a professional program generally has a gatekeeper's role, protecting consumers by identifying and intervening with graduate students who exhibit problematic behaviors.
With the increased awareness of the damage mental health professionals who do not possess the personal qualities necessary for effective practice can cause, there is an ethical imperative for training faculty to serve as gatekeepers for the profession.
A summary of the ethical obligation of faculty members and clinical supervisors in overseeing trainees' work says, ethical standards mandate that educators and trainers attend to the possibility that their trainees' personal problems might lead to harm of others, make sure that trainees are not harming clients or others under their care.
Attend to the possibility that trainees might misuse their influence. Evaluate whether trainees are performing services responsibly. Articulate a clear set of professional standards. Evaluate trainees based on these relevant and established requirements.
Psychological reasons for dismissal, emotional instability, personal disorder, psychopathology, unprofessional demeanor. Faculty cannot rely on screening procedures during the admissions process alone to identify students who do not have the necessary personality characteristics to become competent clinicians.
Now you will have a class discussion on the points made in the presentation. Thanks for listening. Elaine.